Welcome back, viewers, to the third and final segment of our show today. We've been looking at non-communicable diseases in our previous shows and in our previous episode, I beg your pardon, and we have also looked at communicable diseases and non-communicable diseases. Now, in this segment, you're going to look at the risk factors involved in communicable and non-communicable diseases. Kindly take us through that.
Well, thank you. We are going to discuss the risk factors that are in non-communicable diseases, and it's also good to say that non-communicable diseases can be experienced by all ages in all countries globally. There is no specific places whereby you can say that they are immune to these conditions. So mostly those people who are subject to these non-communicable diseases are mostly the older groups, and here we are talking about 30 years and above. However, mostly the 30 years to 69 are the mostly affected, or the low or middle income countries. Especially the low and middle income countries are the ones that are most affected because maybe of their healthcare systems. So the risk factors that we have in the non-communicable diseases, I would start with the number one, which can all say that is the modified behavior risks. So I will connect that to the lifestyle. Mostly our lifestyles have really changed, and by the lifestyle here I'm talking about our eating habits and the lack of exercise, and basically the lifestyle that we are living are subjecting people to these conditions. And by lifestyle, mostly I will concentrate on the eating habits. Eating too much fats, the body accumulates too much fat, and hence the prevalence of diseases like diabetes and hypertension. So basically lifestyle also, too much boarding of vehicles, less exercise, so we find these diseases will always find a way. Lifestyle also, I would also say apart from lifestyle, we also have the drug use. Drugs like tobacco and alcohol are the most abused drugs. You find that some of these cancer, like cancer of the lung cancers, are triggered by the use of tobacco. Alcohol as well has a great effect on diabetes and also in those hypertensive conditions. So we also have the issue of age. Age also is a real factor when it comes to these COPDs, and that is why some of these conditions we always say they are age related. If you look at most of the patients of these chronic ailments, they are mostly the aged persons. For example, a disease like arthritis mostly attacks the old people. Considering the physiology behind the arthritis, you find with old age, the cartilages on the joints are worn out, hence access to diseases like arthritis. Also diseases like high blood pressure and diabetes, you mostly find them with the aged people in the society. However, we cannot ignore the fact that due to some other reasons, these diseases are also coming into also the younger generation, and this is a result of mostly the lifestyle and the lifestyle we are living, and the things that we are being subjected to. And this is where now we go back to the use of drugs and the eating habits. We also have the issue of family. Most of these conditions you find they are hereditary. By this I mean that if you look at the family lineage, you find these conditions are inherited. So you find diseases like pressure and diabetes, and even the cancers, asthma. Mostly if you look at the background, you find there are diseases that occur in a family lineage. So also the hereditary factor also is not something to ignore about. So those are the major predisposing factors when it comes to non-communicable diseases. However, all these conditions, even if someone happens to have them, these diseases we normally say they are not treatable, but they are manageable. You can only manage these conditions by proper health care. And the other thing we can say is we can prevent them. And the question is, how do we prevent them? The best way to prevent these conditions is by, number one, continuous medical checkups. And the continuous medical checkups we are talking about here is mostly the blood pressure checks, the random sugar checks, and also checks for weight. It's very important to be updated on your weight. That comes, those three, they go hand in hand. Your weight, the blood sugars, and also the blood pressure. Very, very essential. And you find in most places, these are not costly tests. So they are very affordable in these health institutions. Then you also have the cancer tests that entail to be done frequently. We have the prostate cancer tests. We have the breast examination tests, and we also have the cervical cancer tests. The cervical cancer is what is called in other terms as pap smear test. So it's very advisable for these cancer tests. At least we are told twice per year or once in every 6 months. Once in every 6 months, they are very beneficial because a condition like cancer, we normally say that the earlier it's diagnosed, the easier it is to manage. So those are the four common tests that we are supposed to take: the blood pressure, the blood sugars, the cancer tests, weight, and we cannot go without mentioning also this now a general, the dental care also is very, very important. So in a nutshell is that frequent body tests are very essential for our health, because if we do them on time, even management will be adequate.
Exactly. And I like the way you're really insisting that the blood pressure test, blood sugar test, and weight are very essential. Maybe take us through when you do the blood sugar test and the blood pressure tests. There are some numbers that are usually written down. I'd like you to tell us if, is there a certain age, when you're at a certain age, are you supposed to have this kind of maybe blood pressure level or blood sugar level? And also, if you're at a certain age, are you supposed to have a certain weight limit?
Well, when I'll first of all discuss about weight. There is a relationship between weight and the height. That is what we call the body mass index. And there are the parameters and the calculations that are done such that your height and your weight should correspond. And that is now how the BMI is called, body mass index, is a number that determines if you are overweight, if you are obese, or if you are underweight. So when you visit your healthcare provider, those are the things that would be explained in a better way. Come to blood pressure. Yes, you've asked about age. Yes, different blood pressures comes with different ages. However, there is the average readings that are supposed to be given in blood pressure. We normally say that in blood pressure test there are 3 numbers. There is one number we say the numerator, the denominator, and there is the pulse rate. The numerator is the number above, and that one we call it diastolic. That is how the heart compress. And the diastolic is how the heart relaxes its muscles in the pumping. So the rate at which the heart muscles compress, it's called the diastolic. The reading should be between 120 to 140. That's the number above. And the below should be around 60. It should be around 70 to 90. The lower number should not go above 90, and the high should not go above 140.
So is that for a normal person?
Yeah, for a normal person.
Okay.
And our heartbeats, as we learned that in primary, on average should be around 72. However, sometimes the heart would beat faster or slower. That one should not be a cause for alarm. But the other readings are the ones that determine. However, if a reading is done once and it shows an abnormal reading, that one does not really necessarily mean that the person has high blood pressure also. You need to have frequent readings for some times so that you can be judged to be having high blood pressure. More so, there are those symptoms that are associated to high blood pressure. So those are conditions, symptoms like headaches, feeling fatigue, tiredness. When such symptoms and such readings come together, that is when a patient can be said to be diagnosed with high blood pressure. Otherwise, one or two readings are not enough to judge that. On the other hand, for diabetes, it's the same. Diabetes, we measure it with the readings called millimoles per liter. The readings for blood pressure, we normally read them as it's a fraction. Remember, the results are written in a fraction way. Then there is the number of pulse, that is a number by its own. And the pulse rate, we say it's the heartbeats. Heartbeats average is 72. And for the reading, the fraction is the denominator. The numerator is normally the contraction of the muscles of the heart, and the denominator is the relaxation of those muscles. So basically, the contractions are higher than the relaxation. That's why you find the higher figure is above the lower figure. So for the numerator, the average is 120 to 140, and the denominator is normally 60. It's normally 70 to 90, or we can say below 90. And the abnormal readings, normally it's when the denominator's reading are more than 90 and the numerator's readings are above 140. So that is the reading for the blood pressure. However, if the reading for once is abnormal, we cannot determine that that's high blood pressure. There has to be some frequent readings that are abnormal, high or low, and also it has to be accompanied by the symptoms. And the symptoms I'm talking about here for blood pressure is fatigue, headache, tiredness, and those are some of the symptoms that would associate the readings to be for high blood pressure. When it comes to blood sugars, blood sugar readings are measured in millimoles per liter, and the normal readings are between 3.5 and 7.5. Anything below 3.5, we normally call that hypoglycemia, whereby we mean that the sugar levels are low, hence the hypo. And above 7.5, we normally say they are hyperglycemia. Hyperglycemia is when the sugars are above 7.5. Most diabetic patients, the sugar levels are way above. And when they are low, we normally say it is very dangerous when the sugars are low than when they are high. When they are high, they can be controlled. But when they are low, that is an emergency case. And it is easier to lose a life when the sugars are low than when the sugars are high. Basically, these conditions is all about management. Managing the sugars and managing the pressure. So that is why we normally say that these conditions, it is easier that's why we encourage people to go for those frequent tests so that it becomes easier to manage them. Same way with cancers, the prostate, the breast examination, and also the cervical cancer. It's very important to have these checks as well as weight.
Thank you so much for such wonderful information. I hope you have really learned regarding the risk factors involved in non-communicable diseases. Unfortunately, our time is up. That's all we had for you today. But if you missed the show, be sure to join us next week. Same place, same time, same show, but a different topic. I was your host, Charity Gordons, and my guest in studio was Mr. James Morongo Njao, and we're so happy for him finding time to be with us. So until next week, it's bye-bye from us. This was the Wholly Healthy Show with me, Charity Gordon.